Ischemic cerebral stroke occurs when a blood vessel feeding part of the brain becomes blocked, partially or completely blocking its blood supply. The affected area of the brain no longer receives adequate oxygen, initiating a process which causes death or serious damage to brain cells, impairing local brain function. Since brain tissue cannot survive without oxygen, there's a limited window of opportunity of several hours after stroke onset for effective treatment. Too little time for many people to reach the hospital and receive treatment. A new medical device, the Ischemic Stroke System, or ISS, from Brainsgate, has the potential for expanding the effective treatment window to up to 24 hours, bringing new hope to millions of stroke victims. The system consists of an implant, driver, and control unit. The implant is a small electrode just over an inch long. Up to 24 hours after ischemic stroke, the implant is inserted under local anesthesia through the patient's palate in a minimally invasive procedure comparable with dental treatment. The entire procedure lasts about 15 minutes. The implant is positioned on the ischemic stroke side, near the sphenopalatine ganglion, or SPG, one of two small nervous centers located behind the nose. Through a transmitter placed on the patient's cheek and held by a headset, the system relays a pre-programmed electric stimulation pattern to the implant and through it to the SPG. The SPG reacts to the stimulation by releasing neurotransmitters such as nitric oxide and vasoactive intestinal polypeptide, which cause blood vessels leading to the brain to dilate, increasing blood supply to the brain. The increase in flow results in delivering more oxygen to ischemic brain tissue, which eventually leads to better neuronal survival, enhanced tissue metabolic recovery, and a better behavioral outcome. Preclinical experiments and a pilot clinical trial indicate that patients receiving SPG stimulation within 24 hours of stroke onset are likely to demonstrate increased cerebral blood flow, augmented cerebral perfusion, and reversal of damage to surrounding tissue sustaining reduced blood supply. The treatment helps improve the neurological deficit, the stroke status, and most importantly, it increases the patient's chance of recovery and quick rehabilitation. By providing more time for effective treatment, the system may dramatically expand therapeutic windows, offering many patients far better prospects for recovery. More time and more hope for stroke victims. The Ischemic Stroke System from Brainsgate.